Have you had any indication at all so far today that there are any cases outside Auckland or Wellington?
No, no indication as yet. So I do know there were cases coming in through the day yesterday. I can say none of those were outside Auckland.
So are we still looking at a single chain of transmission, or no evidence that there is anything beyond that at the moment?
Yeah, the whole genome sequencing, which is going at pace, over 120 sequences already completed, shows very much that this is an outbreak that stemmed from a single introduction, and there are 4 different genetic mutations now that they're able to use to help track the outbreak, in particular whether people are associated with one or other cluster or exposure event.
We've also heard that there are some people in MIQ who aren't being released because they're struggling to go home because of limited flights or transportation. Do you know anything about that?
I don't know anything about that, but it would seem quite possible because of the challenge around very few flights, but I'm sure that each of the MIQ facilities will be working with individuals to organise transport arrangements.
That might have knock-on effects though with people trying to come in, or even if they were quarantine wings in those facilities. And
it may well, and there is real pressure. There was already pressure on managed isolation, and I think that's one of the reasons why the MB team isn't releasing vouchers just at the moment, and because they've converted one of the facilities, of course, to take cases from the community into quarantine if required.
How concerned are you about overall quarantine capacity? I know there were 239 rooms available before the outbreak. You say there's another facility coming online. This morning we've got Sean Hendy talking about maybe up to 1,000 cases in this April outbreak, which was an upper limit before and now is sort of more middle of the road estimation.
Well, actually New Zealand's got good managed isolation quarantine capacity overall. I mean, we even right through the pandemic, we've had about twice the number of rooms compared with, say, Australia per capita. And the ability of MB to convert some of the facilities to quarantine does help, of course. And remembering some of those early cases will be considered recovered as we move through the next few days, and so they will then be able to be released back into their homes, still under Alert Level 4, of course, and that will then free up rooms.
Will we have enough, and you're confident we will have enough, even if we get to 1,000 cases?
Look, we're working really closely with MB, but at the same time, of course, rightly, we are looking at other options, and one of those options is each DHB has been asked to look at how they could safely support isolation of people in the community. We have done this before, and sometimes people don't go into quarantine, for example, if they have physical or issues around support needs. If they've got a disability, they are looked after in their own home. So all DHBs are looking at what arrangements they could put in place to look after cases in their homes should that be required.
And just on that saline issue yesterday, the one in Highbrook, you said yesterday you were comfortable with how that had gone. Just want to ask, if you were one of those 700 odd people, would you not have wanted to know immediately that you, however slim a possibility it was, you might have taken saline instead and been offered a chance to get an actual dose as soon as practicable?
Yeah, and just to explain a little bit about what happened. So there may have been 5 people of the 732 who got a very dilute dose because one of the vials may have been reused in the facility.
I understand that. I'm just saying, if you were one of those people, would you not have wanted to know as soon as practicable?
Well, I think what I would want to know is whether something had happened in the first place, and that was what was being established first. And there is still a difference of views as to whether, in fact, anyone missed out. But secondly, of course, when you tell someone that something like this has happened, you want to ideally tell them what are the options and what can be done about it. And that was the second bit we were just firming up advice on, so that we could tell people. Meantime, all those people, many of them were having their second dose. All those who were having their first, bar 25, have had a second, and those 25 are going to be expedited over the next couple of days. Everyone gets a letter today.
All right. I'll gather from that you were okay if you had been one of those people with how the ministry's handled that. Can you paint a picture of the outbreak so far? When are the earliest symptoms recorded?
10th of August is the earliest date that we've got really reliable symptom onset for one of our cases.
Is that from one of the subclusters identified?
It is, and this is someone who is one of our quite early cases who we think is the most closely connected to the Crown Plaza at this point in time. We may never find out exactly how the virus got there. Just because they were in a place where they may have been exposed to the virus. I don't have the detail about that. Very early on the 9th or 10th. Yeah.
That place being the Crown Plaza or near the Crown Plaza?
Near the Crown Plaza, but it's still
the
just a working
vaccination centre
hypothesis.
nearby that's been talked about?
Not the vaccination centre, I
Just
say that.
a place nearby?
Yeah, and so we're getting very close to understanding the chain of transmission. What we don't yet know and may never know, just as we didn't ever find out in February this year or August last year exactly how the virus got from the hotel into...
But that might have been just one link. If it was a place near the Crown Plaza on that date, it might have been a direct link to a border case, potentially.
It could have been a direct link, but that's what's been looked at. You know, we've had this before where we've never quite been able to nail the exact transmission time and place, but we're pretty close now, and it also explains then how the outbreak developed out from there.
And which subcluster would they belong to? Can you tell me that?
This is someone who is connected to the AOG Mangere cluster, but also has got a number of other sort of household contacts who are also infected as well.
And in terms of the spread and the perimeter of the outbreak, how close do you think we are to getting to knowing that perimeter, especially with some 7,800 by 4 p.m. yesterday, close contacts yet to be reached formally?
Yeah, so the most important thing around understanding the perimeter is the testing results, and there's been very high rates of testing that's been on our side this time, and that's good. And the key thing about the perimeter of it is, first of all, have we confined it just to Auckland, or is it confined just to Auckland? Now, we had that case in Warkworth that was identified yesterday, and we've had the cases in Wellington. So far, it seems that the Wellington cases are contained, which is good. Then, if we look at Auckland, I would say we're getting close to understanding the perimeter of it. And of those close contacts that hadn't been followed up as of yesterday, about 5,000 of them had just come in yesterday and the day before. And so we will be working through those very quickly over the next day or two.
Do you know how many then we're still yet to hear from?
I'll have a look and get the numbers for you after this. Yeah.
Because that's, do you have a sense of whether many of them belong to those potentially belong to each of those subclusters identified, or those higher risk locations of interest that have been identified?
We won't know that until they've been contacted, but the reason they're in our database is because either they've had a test and they're isolating, or they've made contact through Healthline and been referred into the National Contact Tracing Centre, and then we're just waiting to do that outbound call to get that detailed information. It doesn't mean they're wandering around in the community and don't know.
We do want to have a sense of whether they are part of those clusters, don't we, to get an idea of whether they are a higher risk contact, or if they have been, if they might have been a case, if they might have been an essential worker.
Exactly. Those are the three critical bits of information, and particularly for our new cases. Are they an essential worker? Can we link them to existing clusters or households? And of course, were they out and about in the community while potentially infectious? Yep.
Do we have any more information? I know you said the Ministry was working on this, on whether any of these transmissions had occurred after the lockdown had started.
Not yet, but I was working with a couple of people till in the late last evening, working out how we can pull that information out, and we're hoping to have an update on that today at the 1 o'clock.
We had a story this morning about the health response not being able to be deployed as fast as possible because they didn't know how many of the health workers were vaccinated, and there were privacy issues there. That's obviously not ideal, but is there practically anything we can do about that? Obviously, privacy issues are a concern.
Yeah, two things we're doing about it. First of all, we're asking DHBs to keep a record of their staff who are vaccinated, and certainly how many are vaccinated. If they get consent from those staff to record that information, then they can do that. But secondly, we've done some urgent work with the Auckland and Waikato DHBs about, because of the circumstances, being able to link their staff records with the COVID immunisation register, and we've had a privacy office opinion that can be done because of the nature of the circumstances we're in. And the main reason they want to know is so they can deploy staff safely during this sort of alert level.
Would you support making it mandatory? I know it's a political decision, but would you support making it mandatory for all health workers to be vaccinated?
We've been asked to and have given advice around whether and if so, which groups of health workers should be required to be vaccinated depending on the role they're doing. There are very good reasons why I think frontline health workers should be vaccinated to protect themselves, their patients and whānau, and also their colleagues. So we've given our advice, and that's with the government for decision.
And one final question: the contact tracing capacity, the standing capacity before the outbreak, 180 contacts a day. Cases a day, 1,000 contacts a day. That's roughly 55 contacts per case. The outbreak currently is more like 100 per case. Did the ministry underestimate how many contacts per case would be likely in a Delta outbreak?
Not so much that we underestimated it, but the approach we have taken with Auckland Regional Public Health is to go very broad with that definition of who's a close contact. And so the reason we've really scaled up the additional contact tracing capacity is because, unlike the sort of casual contacts, those close contacts require daily check-ins for 14 days and testing and follow-up of results. So it's more those outbound calls, the daily check-ins, is why now we're bringing on that extra capacity to do that.
That seconded workforce was brought in on 6 days into the outbreak. Should it have been done earlier?
We had good workforce to do those initial calls out, and it's just doing all those follow-up calls and also recognising that Healthline is very busy with inbound calls as well, and that was part of our surge capacity.
Thank you very much.
Thanks, Derek.